Bird flu cases have been spreading across the country, with the first ever bird flu death recently reported, a 65-year-old man from Louisiana. Now, we do want to point out that man had other health concerns and exposure to chickens and wild birds, and the CDC maintains bird flu risk to the public is low. But this death has sparked online conversations and an interest in better understanding what's spreading and what we all need to know. Joining us now is Dr. Katrine Wallace, an epidemiologist at the University of Illinois at Chicago School of Public Health. Dr. Wallace, welcome. So far, this virus has not spread from human to human, but it has spread from animals to human. How concerned should the average person be about getting this illness?
The risk to the general public is deemed to be low at this time. But there are groups that are more at risk, like people that are working in commercial farming situations and people that maybe keep backyard flocks of birds. So while the general public is at low risk, there are people that have access to animals that may be at higher risk.
So let me ask you this. HHS recently awarded $306 million to avian flu response. What are the most important things they're trying to address with this funding?
Secretary Becerra has stated that they are allocating this funding for things like preparing for scenarios that could arise. And part of that is disease surveillance, research, laboratory testing, continuing monitoring efforts.
You touched a little earlier on who is most at risk. What are the things that people should be doing to protect themselves against H5N1?
People could get a flu vaccine to prevent against circulating human influenza. This will reduce the likelihood of an avian influenza, human influenza, like recombinant virus. And that, if that happened, could cause, the avian influenza to be able to spread from person to person if those two would combine. So it's good to prevent any kind of influenza right now. But again, preventing any cases of respiratory virus will prevent mutations. So using precautions like masking in crowded spaces, staying home when people are sick, avoiding gatherings, these things are all helpful right now in this time of year that we have.
My children will not be happy to hear that, yes, that flu shot still is important. Dr. Katrine Wallace, thank you so much for joining me today.